So now our provider, we want to check our orders, and he has ordered just a saline lock for our patient. And so we're going to go ahead and take our IV tubing and tube off. And we will start by checking our orders and our MAR. We want to make sure we check our patient's 6 rights. So right patient, right medication, right route, right dose, right time, and right documentation. We want to make sure that we are washing our hands and using proper body mechanics, lifting the patient's bed up so we're not bending over, twisting, or turning, or asking our patient to have his arm placed comfortably for not only him but for us, and making sure that we're not twisting to remove the IV. So I'm going to go ahead and wash my hand, and we want to assess the IV site, make sure that there's no infiltration or inflammation in the IV site, make sure that it's not bleeding anywhere, that it's still intact. Good. And we're going to go ahead and, of course, we'd want to check the patient's ID, so with 2 different identifications. So ask the patient their name and their date of birth. And we're going to go ahead and take the tape off. And this is a tape that was just holding on the tubing, so it was good. We're going to check the saline lock and make sure that it's still on tight enough, and we're just going to twist this off. I already have a gauze piece underneath the saline lock, and I'm just going to roll this tubing up. Oh, before taking it off, I want to make sure that my tubing was clamped and so it's not leaking, and then I take it off. And I'm going to go ahead and hang it up over here, and I'm going to take a alcohol swab and make sure to clean this so that we can flush it with 5 milliliters of just normal saline flush. We're just going to hold this on, twist that, and we're just going to slowly flush our IV with 5 milliliters of all right, and we want to make sure that we teach our patient to how to maintain this IV site. We want to make sure that they're not picking at it, that he is aware that it's there and he's not hitting it against things, and that he's not getting it caught in the sleeve of his clothes or anything. And we want to make sure that we document that we just have a saline lock in there, that we discontinued the IV stuff, and that we flush it with the 5 milliliters, and that it is okay. So our provider has ordered 2 milligrams of Dilaudid for our patient for pain, and so we're going to go ahead and give him his Dilaudid by IV push. So we want to make sure that we're checking the MAR, checking our order, making sure that we have our 6 rights: our right patient, right medication, right dose, right time, right route, and right documentation. We want to check again the medication after we pull it compared to our MAR, and make sure that again that it is the correct medication for the right patient, and it's within the right time frame, and it's the right route again. And so I'm going to go ahead and draw up this medication. Since this vial has been used, we'd want to clean it with an alcohol swab. Since I am running short on my alcohol swabs, I'm just going to verbalize that I cleaned it with my alcohol swab. I have my 3 milliliter syringe, and I'm going to go ahead and attach my 20 gauge needle onto it. And I will, my garbage is right there. I will pull out or put air in for my 2 milligram of Dilaudid. Go ahead and administer that. Sorry, my dog is barking. Let me get this air bubble out. All right. Go ahead and pull this out. I'm just going to put the cap on right here. All right. And so then it is important that when we administrate this medication that we do not push it any faster than 3 to 5 minutes. Okay. And so we'll go ahead and take this into the patient's room, and we would throw our needles in our sharps container. Since I don't have a sharps container, I'm just setting it there. And it is recapped. Before going into, sorry, my dog's barking. Going into the patient's room, we want to check the patient's ID using 2 identifications. Their date of birth will work. I want to make sure that I have good hygiene before administering this medication and or before pulling this medication while administering it. So whether we move or wash our hands, and then we want to make sure that we have good body mechanics. So I will go ahead and raise the bed up so that I am working at a good level for myself and I'm not bending over, twisting, or turning of any sort. I want to make sure that the patient is comfortable as well. Before administering the medication, I want to make sure that I go ahead and flush it first. So we want to clean it with an alcohol swab. And we'll flush it with 5 milliliters. So we'll go ahead and flush it slowly. And we want to make sure that our IV site is not infiltrated or the catheter is still in there. Sorry, as you can see. Make sure that the catheter is still in there, that there's no inflammation, no redding, or redness or anything, and that it still flushes good. If it didn't flush good, or if there was some irritation to the IV site, we would want to DC the IV and go ahead and administer it, get a new IV started. So again, at the bedside, we want to check that we have the right medication and that this is the right patient, our 3rd check on this patient. And we can go ahead and I'm going to clean it again with alcohol and go ahead and, like I said, we don't want to administrate our 2 milligrams Dilaudid any faster than 2 milligrams in 3 to 5 minutes. So we're going to go ahead and take our time. And for the sake of the video, we're going to say that it took me 3.5 minutes to administer this medication. All right, and then we want to go ahead and clean it again with alcohol. And go ahead and put our saline lock, or flush it again with our saline, another 5 milliliters, to make sure that all the medication is administered into the patient. We want to make sure that we sit with our patient for a while and make sure that he doesn't have a reaction to this medication, and that the IV does not get irritated in any sort. We want to make sure that we document that we administer this medication. When we administer, this medication, we want to document the patient's pain level before and reassess the patient after administering this medication in 30 minutes to make sure that the pain has come down from that. And just make sure our patient is comfortable before leaving. All right, our provider has cleared our patient to go home, so we can go ahead and DC our IV now. So we're going to go and do that. We want to make sure that we have all the supplies that we need: gloves, tape, and some gauze. Due to practicing, I do not have any more small pieces of gauze, so this is what I have. But I would use a smaller piece of gauze than this. When going in, we want to make sure Again, we check the orders that it is good to be DC'd and that we had the right patient going in. We want to check the patient with 2 identifications, the patient's name and date of birth, and we want to practice good hand hygiene, washing our hands before contacting the patient, and then we will put on our gloves. And we will raise the bed up and make sure that we have proper body mechanics so that no time in this video we are bending over or DCing this IV, we are bending over, twisting, or we're uncomfortable in any way that could harm us, or the patient is uncomfortable. So we'll go ahead and I want to make sure that we kind of put a little light pressure on the IV, and we'll just loosen up the tape. Actually, I'm going to loosen up the tape. I want to get my gauze out, just so I'm ready for it. All right, so we're going to loosen up our tape and put in some pressure on this. Gently pulling. We want to make sure that we don't pull too hard on our patients. Just gonna have our patient turn our hand so we can get to the IV or to the tape underneath. All right, so we're gonna have our gauze ready. Oh my goodness, sorry, my gauze is sticking to my paper. Okay, so we're gonna have our gauze ready, and we're gonna go ahead and pull out our IV, pull this tape off. We want to put pressure on this IV site for 3 minutes to make sure that the bleeding stops. We want to inspect our IV catheter and make sure everything's intact and everything came off fine. We want to go ahead and throw this into the sharps container, as it is a biohazard. And we're going to put some tape on here. We want to make sure that we dress our IV site with a sterile dressing to prevent any infections. When we removed the IV, and we want to make sure that we check the site to make sure that there's no irritation of any sort, no swelling, no redness, that it's not painful of any sort, and we want to document that we DC'd the IV and when we DC'd the IV, and then our patient should be good to go.